Plastic Surgery, Bluefield Hills, Michigan. So as you will see, 100% total capsulectomy, 2425, initials DL. This is a 69-year-old lady who had a set of what are Cox implants from 1989. So that is 36-year-old set of implants. They are, the inner side is saline, 40 cc's, and the outer side is silicone. And so the silicone is 160 cc's and the saline is 40 cc's on the inside. Now as you can see, complete removal of the entire implant. This is very painful. And as you can see, if you look carefully, this is part of the rib right here. So you can see, in order for me to remove it without any of the breakage of the silicone, so you can see the imprint of the rib right here, and this is actually the cartilage part of the rib. Right here, this is the cartilage part of the rib. In order for me to do what is a complete end block. So all contained, you can see the white inner calcification. So I'm going to cut this open. Now theoretically, because these are this old, I would say they're ruptured, so time will tell as I go in. Intact implant. So this is an intact implant. I must mention right here, as I went in, this is my scissor that just went in. So this is me just now doing this, and so it's yellow. You can see it's kind of disintegrated, if you will, but very much still intact. Look, 36 years later, this Cox implant, and you can see. Let's see on the inside if we see any saline or not. Nothing that I'm seeing. Alright, so this is an intact implant. You can see the color, and you can see on the inside, complete end block, everything contained. And you can see, look how thin this capsule is. If I put it right on top of the ruler, you can read the ruler. So overall, very happy, and again, nice, good, surprise that these are intact and good for her. I'm going to remove my top glove. So left side, I removed some of the skin, and as you can see, I'm very happy and content with how the whole dissection has gone. Some of the tissue that I removed that was inflamed. Now as you can see, look, this is pointy over here. Now remember, it was compressed, and look how it's now splaying open. So as I go in right here, let's see what this shows. You can see some what appears to be inflamed tissue right here. You can see how thin it is. You can see my scissor right here. So this is a different consistency, as you will see. So this is ruptured. You can see, and still conforms overall, but as you can see, this is, compared to this one, you can see the difference, but still relatively very cohesive, if you will, and you can see the inside. I'm very happy how the whole surgery went. It was like literally super glued to the rib. So the 100% total capsulectomy, 0% of the capsule remains behind. The inflamed tissue around has been removed. As you will see, if I go like this, look at this. This is that cohesive implant. Interesting, this is 1989. And so it's not denatured like the one. Exactly 2 weeks ago, I did a case at the hospital. Please go see that Facebook Live. It was a 775 cc implant from 2017. And that had completely disintegrated. It was like jello broken up into multiple pieces. This one, 36 years later, it's still very cohesive. So I like how this looks, but again, look at this. God knows how long she has been in this state, but overall, everything contained, all inflamed tissue removed. We'll see how she bounces back. The blood loss was minimal. It took a long time for me to doing the surgery. It's almost 10:10 right now. So the implants will be returned to the patient. Capsules will be sent to pathology, rule out the BIL, CLCD30 analysis, rule out lymphoma, rule out malignancy, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how this nice, pleasant lady from out of state does post-op, minus the capsular contracture she had on the right and also on the left, and minus the silicone toxicity that she had, that she came in with. We'll see how she's going to do clinically. So there you have it. This is Dr. Khan, Executive Plastic Surgery. There's no